Welcome back to News Inside. Well, there are some developing stories in our both political, economical, and the social aspect of our nation. One of them is that the former deputy governor of Edo State, Philip Shaibu, said lobbying is a way in the National Assembly. I really wonder how long. Of course, in politics, lobbying is good. Do you understand? But you think about the people first, and other one. Then Kemi Badnoch, I don't think he's having it very good in the UK. The Labour Party says he's just trying to save face, because he's trying to do everything to make it look as if he's a nationalistic person. Then on the economic side, Tinubu eyes India's blueprint for Nigeria's growth. I've always said that the major thing they need to do is to develop internally and not look at other people, because India, for example, have their culture, have their terrain, and so many other things.
We should create our own model.
We should create our own model instead of always looking at somebody. Of course, you can still here, like China have done. But I think one of the major things is to always make sure that they do what is internal with them. But one we want to discuss right now is this issue of fake drugs from Aba to Onitsha, then to Lagos. I mean, it's prevalent. Not only that, they even found out drugs that are expired, drugs that are supposed to have been destroyed,
and the ones that are supposed to have been distributed free, like the HIV,
the retroviral drugs.
What of the condoms too?
Yes, expired condoms that should have been used.
That are expired.
And then eventually
I'm suspecting
you. Eventually they will be sold. No.
And when the condoms are sold, because they are expired, they can burst. But that's the Peter, you're a recalcitrant child. And the major one also is the fact that there were some drugs that USAID gave to those people, and whether they were free.
Free.
But now they are under being told.
Now, when you go to general hospitals, thank God for some of us that are privileged to be, should I say, completely healthy. Those that have HIV, it's not all of them that contracted this disease by having sexual intercourse. There are unfortunate situations you could get from barber's shop. You could get from hotel.
Those are very many.
You could get from nail cutting. Like me, I don't cut my nails on the leg. You could even get from doing pedicure. You could even get from blood transmission, and there could be an accident in the
so many ways of getting.
Now, they know that you need drugs. Such people need drugs to survive. People have paid for these drugs. These drugs have been produced. They paid for them to be shipped to the country. They were shipped down here and given to people that were supposed to distribute them. Do you know the stress some of these people pass through to go to certain hospitals to get them? NAFDAC went as far as explaining certain drugs that, like anti-rabies drugs, these drugs are not supposed to be kept. They're supposed to be kept in a certain level of temperature. These drugs were supposed to be in fridges, not freezers. Now, NAFDAC discovered in their course of investigation that certain warehouses were not even created to be able to keep these drugs in such a way that they will remain very, very effective when consumed. Patients that have diabetes and other things like that, just but to mention a few.
All right.
So now,
hold on. Peter, tell us, this fight by NAFDAC on, because the last time we discussed about, Peter Obi said that the whole market shouldn't have been shut down, yes. That it's economical, it has some economical sabotage effect on other people. But I think what NAFDAC is doing is that these people have a syndicate that until everybody's out, you can carry out a thorough cleanup of especially this drug, and they are fundamental to human health.
Yeah, let me address let me make clear what Obi actually said. OBE was never against what they're doing, but shutting the entire market that has both plumbing material, electrical material. No, this market is segmented. You should go to where these drug people stay. Close there down. Do what you want to do. Don't shut down entire market. But true that we all were happy with what we're hearing from NAFDAC. They've been quiet for a while, and we feel that they are not there, just answering them for the sake. But what they are doing is quite impressive. But another question should be asked: how did these drugs get into our system, into our country?
There's custom.
Who collected at the border?
Yes.
So it should be holistic, not just that person that sells it. They're all culpable. The government officials allowed it in. The people at the borders allowed it in. This thing did not just disappear into Nigeria. People were paid to protect our borders. So why did they allow this in? And again, the drugs that USAID gave for free distribution, how did they get to these people's hand? Who collaborated with them to move the drug from the warehouse?
Of USAID.
So this is a big, what is the right word here now? It is a conglomerate business. It's just it's not a one-man business. They have every other person working for them. For you to move these drugs from US warehouse, it's not one man's business. So not that you look beyond those that have in their shops.
Yeah.
You should look for those that
how they get these things.
Thank you.
Customs should be involved.
Anyway,
immigration should be involved.
So they should answer the question: how did
course.
the
Manufacturers Association of Nigeria should be involved.
Warehouse and get to the market.
And get to the market, because they are supposed to also monitor how these drugs were being distributed. But I remember NAFDAC again is telling Nigerians and pleading with the federal government to look into their own situation, that they have shortage of staff and even funds to be able to do their job effectively. And they've made so many arrests into trillions of naira as values of what had been seized so far. And then a large quantity in Kano, Lagos, Aba, and Onitsha. And then that she promised, the head of NAFDAC promised that they will not stop until they get to the end of this.
See, how many of those people have ever been convicted? It's said them that will go and sabotage the court process.
Well, I think apart from when Dora
there's
was
a difference between arrest and conviction.
Yeah.
I can arrest you for a crime, but you might not be convicted. Same me will go through back, go and tell
give you soft landing.
Present some document that court will look at it based on technical issue and let go of the case.
So that is another problem we're
So
talking
nobody gets
about.
convicted, nobody gets punished for these things, and it
And until punishment come, it's going to go on and on and on and on. Well, now you talked about NAFDAC appealing for more funding,
and staff.
more staffing. Now I think that when every need comes up, when you show that there is a need for this thing, the federal government will provide. During the time of Dora Akunyili, I mean, they were well funded, they were well remunerated, and then they were well staffed. Do you understand? But it's for them to show that we are working. Now, until, like what Peter said, until we see it, that they have brought a lot of people to justice. Jonathan, and sanitize the whole. You see, a lot of department needs to be there.
Yeah.
The Pharmaceutical Association of Nigeria, they need to lend a hand. The Medical Association of Nigeria, they need to lend a hand. The police, the custom, all these people, because you see, it's a cartel.
All the agencies.
It's a cartel.
It's a cartel.
Yeah, it's a cartel. All the agencies, custom, immigration, all these people all needs to be involved.
Do you know anybody dies every day based on fake drugs? Fake drugs?
You could,
Adulterated
and
drugs?
very painful. Someone is ill, go to the hospital, they give you injection that doctor feel that is what you need, and the next thing is it will seize your breath and the person is gone. But another thing again is this: we should also look into it very critically. I think NAFDAC have started something very good. You see, when Nigerians, let's not just talk about people, when certain Nigerians began to cry out, no, this is too hard, why will you just go shut down market? Now they have brought out evidence, and then they are giving reasons why they did what they did and why they are doing what they are doing. And you have said something here right now that it's not enough to arrest and seize, that the people should be prosecuted. NAFDAC are not in position to do this, the judiciary.
No. That's not how it works. For example, hold on.
Okay, fine.
NAFDAC takes these people to the police and sue them to court.
Court, yes.
Do you understand?
The judiciary.
Now, no. in suing them to court is based on evidence that they gather, that the judges will work on. Do you understand? Now, if at the point that they are not getting their cases done, they also shout out and said, with all the glowing evidence against these people, the courts are setting them free. But they've not gotten there. Until we get there, that's when we know what to do.
But for now, they should put pressure on those on the borders. See, let's stop fighting this war inside. Let's stop it from entering inside. Let's what at the borders.
Custom, immigration.
Yes, all the drugs we talked about here are not being manufactured in Nigeria.
If you don't come in, we have these issues. So customs should be held liable too. They should come up. They should help NAFDAC. They should help Nigerians. Because Nigeria is trade by barter now. Probably if you're a customs officer, some of your guys are involved in this.
There's nothing sorry about
this trade. It is
because even the NAFDAC staff, NDLEA, they are all every border, every checkpoint at every border. You see NDLEA, you see the police, you see the custom. It's not a custom head, is their primary jurisdiction. But every other agencies, every other department are there with them.
Yeah, the ports.
So like you rightly said, they should find out from the people whose goods were seized. How did you get these goods?
Thank you.
Where did these goods come from?
And they should bring these people that are these agencies, some of the people that are manning those posts into
they should have a team for this.
Yes.
Because Nigerians are dying.
Well, what we continually work on is the Nigerian that works for everybody, where you go to the pharmacy to buy drugs, they will not be counterfeit or fake drugs. And the pharmacists, the hospitals, the NDLEA, all of them put together, including NAFDAC, are people that, you see, it's not all about also drugs that come from outside. Every packaged food is controlled by NAFDAC. And both internally and externally, they should make sure that these things are good. Like we said,
who gives the NAFDAC numbers?
NAFDAC.
So some of the stats are compromised.
Remember the complaint.
I don't work in NAFDAC.
Remember how
it's very easy to get NAFDAC number on your products.
Without due process of consultation.
NAFDAC went as far as even complaining about how expired drugs that are supposed to have been expired and destroyed, they will change the dates. So that it will look as if they are still valid, they are still okay. So, like we have said, let the judiciary sit up on this. As NAFDAC is crying.
If they are prosecuted and taken to court.
Let all agencies that are involved in the process of investigation, prosecution, and passing of judgment, let them sit up on this and use this as an example. Because I know
we can't take more than that. Yeah. The Nigerian that works for everybody is what we are talking about. We'll be right back on News Insight.